incentives are provided, and so that is also kind of a hook for bringing people into the study, but we end up doing a lot more work with them, which I'll talk about in a minute. So who are we seeing? We've done approximately 574 intake interviews since 2005 when we started doing our research. Our study is largely, it's much more, there are many more men involved than women. It's largely white, and so you'll see from these statistics here that it's 95% white and 4% mixed, and I know that's kind of lame to just lump everyone together, but at the time that we were doing this analysis, it's a little bit more complicated in terms of how people identify. The takeaway message here, we recognize that most of the people we're seeing are white, and we don't know whether that's because in New York City, we're sure that there are injectors of color, but for some reason, we're not able to reach that population right now, and I don't know whether it's because it's getting pushed underground a lot. Drug use in general has been highly, obviously it's really criminalized, and it's changed even a lot more as gentrification of the city is taking place, and so it's getting pushed underground a lot. And so we think there's cultural issues, but it's largely white people that we're seeing. A large number of people are between 18 and 30, we're seeing people 18 to 35. But you'll also see what I wanted to point out from here is that a large number of the people we're seeing are between 26 and 35. And one of the things in New York, at least in the area where we're working, is that there are certain services provided to youth that are 24 and under. And then there's a number of other needle exchange programs in the area. But a lot of their services are focused on people who are a little bit older. And so there's this gap in services for people between 26 and maybe, say, 40 years old or something. And so what we've tried to do, which we think is innovative as a research study, is try to incorporate a whole number of other social services into the research that we're doing. And that's really what I think is, when I talked about the way that we're doing the research as being innovative, I think that's kind of the crux of it. And I'll talk about that more a little bit now. So basically, we're seeing about 20 to 25 people in that weekly, bi-weekly cohort. So where I said we follow people on an ongoing basis and test them for hepatitis C on the ongoing basis. But in addition to the research that we're funded to do, to look at the viral kinetics of hepatitis C, to look at the immune response to hepatitis C, collecting all of the blood work, we're also doing this service component. And this is not something we're funded to do, but as researchers and as harm reductionists and as people who are working to meet the needs of the people that we're working with, as we're, our kind of research model is research meeting needs now for the people that we're working with. We've also incorporated a whole number of other services. So we've got a community drop-in space for participants and non-participants alike. So we've got lots of people coming in all of the time. This provides a unique opportunity for us to engage with people on an ongoing basis around hepatitis C prevention because we're spending a lot of time with people, and so we get a chance to really kind of know what their day-to-day injection practices look like, know what their risk looks like. We have a real opportunity to build trust with people, and that's where we really place a huge part of our emphasis. Because we're doing a research study where we're seeing people every week or two, and they're coming in partly because we have this financial incentive attached to it, but it's also an opportunity for people who may not be connected to other services to start engaging in services. And so that's why we provide all these other services as well. And we see it directly tied to hepatitis C prevention. Because if you don't have trust with people and you're not meeting their needs in any other way, then you're not going to have the conversations in as valuable a way to be able to really get to the crux of what you're trying to do. At least that's what we have found. So we also do safer injection. We provide supplies for safer injection, cookers, cottons, waters, ties, are constantly engaged in discussions about that, condoms as well. Overdose supplies and education. We've had trainings on site for overdose prevention, but we also responded successfully to 8 overdoses, successfully reversed 8 overdoses in or around our site. So all of our staff is trained on how to respond to overdoses as well. We have mental health and crisis management counseling. All of these are sort of, again, tied to hepatitis C prevention, because through this process of building trust with people and meeting all these other needs, we're able to engage in a different way about hepatitis C prevention as well. So for example, when I say that we have resources and referrals where we'll refer to detox, sometimes that actually means going to the hospital and spending 4 hours in the waiting room with someone in order to help them actually get into that service. And then later, if people want to talk to us about other things, we'll also be available then. But it's a huge part of it is about building that trust and breaking down any kind of stigma associated, so that people feel invested in taking care of themselves as well, and know that we care about them and want them to take care of themselves. So it's about trust, contact, engagement with people on an ongoing basis, and sort of increasing self-worth. And we see all of these things, again, as related to hepatitis C prevention and the research that we're doing. So we have a whole bunch of miscellaneous services as well: bathroom, storage, clothing, mailing address, basically whatever we can do. We feel like we've got this pool of money to do our research. If we can do other things on top of that, not only is it going to help our research, because people are going to stay in contact with us and we're going to be able to continue to test people over a period of time. For example, one guy in our study, he was kind of like a person who was really resistant at first a little bit. He came because he wanted the money, but he had a hard time forming relationships with trusting people. And over time, because we were able to engage and really be interested in who he was outside of just his drug use, talking about other things going on in his life and really invest in him, we've been able to keep in touch with him. He's totally left the city. He calls and checks in with us every couple of months, if not more frequently. And we actually found out through testing him whenever he would come back to town, when he was one person who at the beginning of our study was negative. He enrolled in our cohort. We followed him for a period of time. During our study, he tested positive for hepatitis C. We followed him again after that. He wasn't interested in treatment. He ended up leaving the city, came back a year later. He came back first about 6 months later, was still positive, and then came back 6 months after that and had cleared the virus. So it's very unusual that someone would clear maybe a year out. We got 5 minutes left? Okay. Whew. It's amazing how quickly the time goes.